कितने पूछे हुए और किसी को तो बुलाओ और किसको बुलाओ बाकी लोगों को एक बार जो भी खड़े आस्था आयुषी बुला Good morning, everyone. My name is. Start. Good morning, everyone. My name is Shubhanshi Tiwati. I am going to give a presentation on mechanism of action of benzodiazepines. The learning objectives will be introduction, classification, and mechanism of action. Introduction. This basically comes under the classification of sedatives and hypnotics. There is a difference between sedative and hypnotic. Sedative is what? A drug that subdues excitement and calms the subject without inducing sleep, though drowsiness may be produced. Sedation refers to decreased responsiveness to any level of stimulation associated with some degree in motor activity and ideation, some decreased. Hypnotic is a drug that induces and maintains sleep similar to normal arousable sleep. This is not to be confused with hypnosis. The sedative and hypnotics are more or less global CNS depressants with somewhat different time action and dose action relationships. Those with quicker onset, short duration, steeper dose response curves are preferred as hypnotics, while more slowly acting drugs with flatter dose response curves are preferred or employed as sedatives. This is the classification. Benzodiazepines, barbiturates, and miscellaneous agents comes in the sedative and hypnotics. Chlordiazepoxide and diazepam were introduced in anti-anxiety drugs. Since then, this class has proliferated and has replaced barbiturates as hypnotic and sedatives as well. Because benzodiazepines produce a lower degree of neuronal depression than barbiturates. Hypnotic doses do not affect respiration or cardiovascular functions. Benzodiazepines have practically no action on other body systems. Benzodiazepines for less distortion of sleep architecture, they have lower abuse liability. A specific benzodiazepine antagonist, flumazenil, is available, which can be used in case of poisoning or benzodiazepine toxicity. Though a benzodiazepine is not that toxic, if taken orally, 20 tablets also don't cause death. They only cause unconsciousness and a mild amnesia. Classification according to duration of action. Short duration, 3 to 5 hours is triazolam. Intermediate, 6 to 24 hours is alprazolam, lorazepam, estazolam, oxazepam. Long acting, 24 to 72 hours, chlordiazepoxide, diazepam, florazepam, clonazepam. Mechanism of action. It basically is a CNS depressant, enhances the effect of GABA. GABA is a neurotransmitter that inhibits neuronal activity, that is, reduces the firing rate of neurons. Benzodiazepines act, basically they act on the alpha gamma junction, act preferentially on the midbrain ascending reticular formation of the limbic system. Mechanism of action. Benzodiazepines act by enhancing presynaptic, postsynaptic inhibition through a specific benzodiazepine receptor, which is an integral part of the GABA as a receptor chloride channel complex. The subunits of this complex form a pentameric transmembrane anion channel gated by the primary ligand GABA and modulated by secondary ligands, which include benzodiazepines. Benzodiazepines bind to specific site on GABA A receptors, alpha gamma confluence, increase the frequency of opening of chloride channel. More chloride channel enter the lumen of the complex, more the hyperpolarization and more the relaxed lumen gets. Increase in GABA mediated chloride current, membrane hyperpolarization leads to CNS depression. Reference carries it happen. Thank you.
Good morning, everyone. My name is Shwetanjali Singh. I'm presenting the topic of side effect of benzodiazepine. Benzodiazepine is used in a treatment of some form of epilepsy and severe muscle spasms and pre-anesthetic medication. Majority of prescriptions are written from hypnotic and anxiolytic effect used as a adjunct in treatment of depression and schizophrenia. Classification of benzodiazepine. Benzodiazepine divided in two groups, long-acting benzodiazepine and short-acting benzodiazepine. Long-acting benzodiazepine are flurazepam, diazepam, nitrazepam, lorazepam, and short-acting diazepine, alprazolam, temazepine, and triazolam. Therapeutic indication. So, KDT. Therapeutic indication, insomnia, anxiety disorder, like panic disorder, generalized anxiety disorder, social anxiety disorder, anxiety associated with depression, bipolar disorder, catatonia, and akathisia. Side effect of benzodiazepine. Most common side effect of benzodiazepine is drowsiness, which occur in 10% of all people. Because this adverse effect, people should be careful while driving or using danger machines when taking drugs. Some people also experience ataxia and dizziness. This symptom can result in fall and hip fractures, especially in elderly people. Most severe adverse effects of benzodiazepine occur when other sedative substances such as alcohol are taken concurrently. This combination can result in marked drowsiness, disinhibition, or respiratory depression. High potency benzodiazepine, especially triazolam, can cause anterograde amnesia. Paradoxical increase in aggression has been reported in people with pre-existing brain damage. Allergy reaction to the drugs are rare, but few study reports macropepharesis and generalized itching. The symptom of benzodiazepine intoxication is confusion, slurred speech, ataxia, dyspnea, and hyperreflexia. Elderly people with hepatic disease are likely to have adverse effect and toxicity, including hepatic coma, especially when drugs are given repeatedly. Benzodiazepine can produce impairment of respiration in people with COPD and sleep apnea. Alprazolam may be cause weight gain. Benzodiazepine are teratogenic. This use during pregnancy is not advised. Use of benzodiazepine in third trimester can precipitate a withdrawal syndrome in newborn. Benzodiazepine are secreted in breast milk in sufficient concentration, may be cause dyspnea, bradycardia, drowsiness in newborn. Drug interaction. Respiratory depression occur when benzodiazepine are administration with CNS depression like such as alcohol, barbiturate, opioids, and antihistamine. Ataxia and dysarthria may be occur when lithium, antipsychotic, and clonazepam are combined. Benzodiazepine and clonazepam has been reported to cause delirium. Antacid may be reduced GI absorption of benzodiazepine. Death has been reported when IV azorapam is given with parenteral olgepine. Tolerance, dependence, and withdrawal. Benzodiazepine are used for short period, 1 to 2 weeks in moderate dose. They usually cause no significant tolerance, dependence, or withdrawal effect. Short-acting triazolam may be exception of this rule. Benzodiazepine withdrawal syndrome depend on how long duration people taken the drugs, what dose, how quickly they taper it, and half-life of compound. Abrupt discontinuance of benzodiazepine, particularly short-life drugs, is associated with severe withdrawal symptoms like depression, delirium, and seizure. Sign and symptom of benzodiazepine withdrawal: anxiety, irritability, insomnia, nausea, tremor, delirium, myoclonus, and seizure. When the medication is discontinued, drug must be tapered slowly, 25% in a week. Otherwise, recurrence or rebound of symptom. Monitoring of withdrawal symptom and psychological support of person are helpful. Use of carbazepine during benzodiazepine discontinue has been reported to permit a more and rapid and better tolerate withdrawal than does a gradual taper alone. References synopsis of psychiatry and Mosley prescribed guidelines in psychiatry. Thank you. सर वो जो डायग्राम था
norepinephrine transporter and the serotonin transporter, which mediate the active reuptake of biogenic amines, norepinephrine and serotonin into the neurons and thus potentiate them by increasing their availability in the synaptic cleft. This is the figure with TCAs and SSR. TCA inhibit the norepinephrine transporter and the SCRT, which inhibit the reuptake of norepinephrine, thus increasing the availability of the biogenic amines. Now, there were some limitations in the TCAs, that there were anticholinergic side effects and the sedation. So in the 1980s, SSRIs were developed, including fluoxetine, citalopram, escitalopram, sertraline, and fluvoxamine. SSRIs are effective in treating major depressive disorder. Also used as anxiolytics in treatment of OCD, obsessive compulsive disorder, and panic disorder. Mechanism of action: SCRT, serotonin reuptake transporter, mediates the reuptake of serotonin into the presynaptic terminal. Neuronal uptake is the primary process by which neurotransmission by 5-HT is terminated. Thus, treatment with an SSRI initially blocks the reuptake and result in enhanced and prolonged serotonergic neurotransmission. They are devoid of alpha adrenergic blocking action. Thus, posterior hypotension does not occur, making suitable for elderly patients. SSRIs inhibit the SCRT, which inhibit the reuptake of virus. Increased synaptic availability of serotonin stimulates a large number of postsynaptic 5-HT receptor subtypes, as well as the somatodendritic and presynaptic terminal receptors, which regulate the serotonergic neuron activity and serotonin release. The reference is Goodman and Gilman textbook of pharmacology and pharmacology textbook of chemistry. Thank you.
आप लोगों को क्वेश्चन है मैकेनिज्म एक्शन अगर ये है तो जैसे जो एंटीडिप्रेसेंट का इमीडिएट होना चाहिए वो तो सिनेप्टिक फैक्टर तो बड़ा वो फिर आपने टाइम भी लगता है यही मैकेनिज्म सिनेप्टिक फ्लैश में सेरोटोनिन या नॉरएड्रेनालिन बढ़ गया या मैकेनिज्म एक्शन से बढ़ गया. If you know, then you can definitely. It takes time for it. You have to do the synaptic left. Just like तो पील लेते हैं उसके लिए पार्किंसंस के लिए इतना टाइम तो सिंपल होगा इसमें से रखने से टाइम बढ़ेगा ठीक है.
और फोटो खींच रहे जल्दी खत्म करो. मेरा तो कैंडिडेट फटाफट आओ यार काम को ऊपरी जाना है फिर भाई किताब में फटो वहां पे जाओ. आप दो नेक्स्ट आप साइड पे डालते हैं. हो गया अब दूध में डाल अच्छा वो वाला कैसे आगे नहीं
Very excited.